because we're receiving real-time images of our patient's jawbone during the surgery, and we can see our instruments in the patient's jawbones, imagine that Superman is doing a surgery, and with his X-ray vision he can see exactly where I'm working and understand the surroundings and understand all these vital anatomical structures that we need to avoid during implant placement.
So how is GPS technology applied in dental implantology? Similar to the satellite navigation method used in GPS, the system consists of a volumetric tracking unit. The system incorporates an optical tracking unit, utilizing infrared technology to monitor the activities within the surgical area. The handpiece and a reference body attached to the patient's jaw constantly transmit their position coordinates. These signals are tracked by an overhead satellite and transferred to the processing unit. The position coordinates are combined with the preoperative data and displayed on screen. The system's highly compact design ensures its seamless integration into any clinic. During the operation, the system provides a real-time view of the surgical area, merging the patient anatomy with the drill position. The computer-generated view accurately guides the surgeon to the corresponding location of the drill on the bone, with online tracking of the precise angle and depth. Now, the optimal position selected during planning can be followed to achieve the ideal end result. If any deviation from the plan occurs, the system will immediately warn the surgeon with audio-visual indicators, preventing possible damage to neighboring anatomical structures.
The system provides me with excellent software for planning the implant position and angulations. But the more important point is that it consequently navigates me to place the implant exactly as planned. There are no more uncertainties. What you plan is what you get. I can see the critical anatomical structures and take them into consideration in the planning process. Using the system, I'm able to use longer implants and to place them directly over the inferior alveolar nerve canal or maxillary sinus.
Pre-planning the operation defines the guidelines for an optimal implant placement procedure. Merging the digital preoperative data, the system automatically generates a complete model of the bone structure and provides an extremely accurate panoramic and cross-sectional view. Through this model, the features of critical structures become fully visible and can be taken into consideration. The surgeon can precisely determine the ideal location and angle, then position a virtual implant which will be used to support the most functional and aesthetic restoration.
The system enables me to plan the implants directly over the CT scan image and correlate it to the prosthetic needs of the patient. If the bone availability is limited, I can evaluate both the anatomical and prosthetic parameters simultaneously and take the best route for the given situation. In a variety of cases, working with the system calls for less gingival cutting, resulting in less pain and swelling and improved healing. This, plus the amazing accuracy the system provides and the online guidance during the operation, gives me the confidence that what I'm doing is really the best treatment for my patient. When I heard about the system, I must admit I was somewhat hesitant. But as soon as I used the system, I immediately recognized its potential. It really does help the procedure immensely. But above all, it's an intuitive and user-friendly system, which increases the satisfaction and confidence in my work.